Welcome to our three-part web series called Healthcare Transitions. Our mission is educating you on the power of using experts to help you decode Medicare, elder law, and navigating our healthcare system. When you are empowered with accurate and efficient information, you can protect your family, spend your Medicare dollars well, and remain calm and confident in your daily lives. This group of experts we have for you in the series include Bridget Skelton, RN of CareVita Senior Care Management, Keith Nabb of Affordable Medicare Solutions, and Cherish De La Cruz of De La Cruz Law. Each expert will highlight one area of information in each 20-minute program. Keith Nabb will speak today on making Medicare work for you. Keith Nabb has been helping seniors and the adult children of seniors for over 25 years. His agency, Affordable Medicare Solutions, is the highest awarded agency for Medicare in Georgia. He has taught over 1,000 classes on Medicare to professionals, consumers, and healthcare workers. Keith, please introduce yourself to our audience.
Thank you very much, Bridget. I'm glad to be here today. And my agency is in Suwanee, Georgia, and we have been here since 1995, and I have myself and 8 employees. And that means we are a high service agency. We can provide year-round service to the families and to all of our partners that seek us out as a Medicare resource office. Today, we're going to be talking about making Medicare work for you. And the idea on Medicare is that it is not set it and forget it. Medicare is something that you manage year by year, yet consumers are not taught this. They've never basically had to take care of their benefits. They usually had it selected for them at work. And then when you go into Medicare, it's a confusing system. They don't realize they do need to manage each year, or if they're having a transition in their life. So the simplest and quickest thing that everyone needs to do when they're in Medicare and they receive their Medicare ID number is that you can go to Medicare.gov, that's G-O-V, and you can create a Medicare login. You have to have your Medicare ID number, and you'll use that, and you'll create a login and a password. The neat thing about this is you'll be able to manage your Medicare account there. You'll be able to print temporary ID cards. You can see the in-force status of all the Medicare plans you have, or if you're doing this for your parent, you can see all of the programs that your parent has in place. And at the end of each year, you can analyze and select new Medicare options, especially such as a prescription drug plan each fall. Very important, and you can update that site very easily. This is a screenshot from there. You'll create a username and a password. You'll enter the Medicare number, and you'll put in the date of birth, zip code, and some other information, and it's very quick, maybe a minute or so to get this done. Now, we're going to do a quick review because people right off the bat think Medicare is sort of a one set program, and it's not. There's actually 2 ways to access Medicare. Medicare has evolved over 50 years or more than 50 years, and they have a traditional side of Medicare as well as a new modern side of Medicare that is more similar to corporate health care. So if you look at the 2 sides of Medicare, the new side of Medicare is where you'll find the network-based plans, the HMO and PPO plans, health maintenance organization or preferred provider organizations. And under traditional Medicare, you don't have networks. You just choose a doctor who will see you and that takes Medicare. You have to understand that this difference between these 2 programs are vital. There's lots of differences. And we have a book, a 12-page book on Medicare. We have educational flyers on this at our website. And I even teach a 1-hour class on this subject because there are so many questions. But basically, if we look at the basics, traditional Medicare is where we call it prepaying for your medical care. You can buy a simple small insurance policy called a MEDIGAP or a Medicare supplement policy, and it pays your bills when you go to the hospital, when you have cancer treatments, when you go to the doctor. Very simple. It just lays in the background. Basically, with modernized Medicare, you pay as you need care. You pay as you go. So you'll pay a copay to go see the doctor. You might pay $10 to the primary care and maybe $30 or $40 to the specialist. You'll pay a copay for lab work or MRIs or hospital stays. When you need care is when you'll pay. Also, though, the big difference is with modernized Medicare, there are a lot of extra benefits that have been thrown into those plans over the last couple of years, and there's a lot of advertising surrounding those benefits. So let's go over those so you can understand. The extra healthcare benefits that the government has authorized for these plans to include in the new Medicare HMO and PPO options can be things such as dental care, vision care, hearing aids. They might even pay for you to go to the gym, or right now while the gyms are closed, they do online health coaching classes. They might give you cash or gift card payments for going to do your well care. Some of the plans give you over-the-counter medical items for free. So if you need vitamins or sunscreen, they'll just mail them to you for free. Meal delivery after a hospitalization. It makes sense. If you go to a rehab center, they feed you. But if you go home, Medicare doesn't feed you. Well, a lot of the new programs will provide 14 meals delivered to your home, and you'll have your nutrition, and it can be balanced based on your health condition. There's also some plans, a very small number of plans that have taken advantage of some new rules where they'll offer some transportation benefits or even home care assistance. So we're watching that category right now, but it's not widespread at this point. So if you don't use the new HMO or PPO style of Medicare plans, you would use a MEDIGAP plan. These are extremely popular, and I have thousands of clients that have a simple Medicare supplement or MEDIGAP plan. Those terms are interchangeable. This is a simple small insurance policy that pays for what Medicare leaves behind, and they're very affordable. Typical plan at age 65 is maybe $130 per month. And this little insurance policy makes no decisions on your health care. Medicare makes all the decisions. Your doctor and your hospital don't have to join any network to be part of these programs, and they've been very popular for over 40 years. And part of the popularity is that if you do travel around the United States, your coverage will not change. So if you have a house here in Georgia and also a house in Florida, your coverage will be identical. Another example of why Medicare is not set it and forget it is that you need to do annual reviews. And here's some key elements of an annual review. You want to make sure that your drugs and your pharmacy are covered in the upcoming year. So in October or November, you can figure out if your plan is going to cover CVS or Walgreens, whichever pharmacy you need, and also that your expensive drugs are not all of a sudden uncovered. You want to make sure that they're on your plan. You must also make sure your doctor and hospital are covered. Is your doctor still going to take Medicare next year? Is your doctor still going to be part of your network if you have a PPO Medicare plan? But a really big issue here is that sometimes people find out that they're being overcharged by premiums on their plans. They'll start out with a very low premium plan, and then a year or two later, it's gone up by double or triple in price. And you need to pay attention because they will sneak those prices up if you're not watching. You do also need to be advised on new Medicare rules. For example, this year, we were given a new period, even after the annual period, where in the first of the year, we can make some changes. You also need to tell your Medicare advisor agent about any upcoming life events, such as if you're going to sell your house and move. You need to have that discussion so you can prepare for that event. So what happens if you mess up and you do not take care of your Medicare, which is you should do that during October 15th to December 7th? Well, if you don't, some of the plans can be fixed in the first 3 months of the year. This is a new period I was mentioning about one-time chance, a mulligan, that you can make some changes January, February, and March. And the only plans that applies to are the HMO and PPO options. So a good example is someone finds out their doctor or hospital is not covered in January, they can switch to the right plan starting February 1st. Or if during the year you have a special event or a special exception, such as a move or a dramatic income change or a loss of a spouse, or you apply and receive federal assistance for help with your drugs, we can make changes 60 days around that event. So that helps us out to fix things in the middle of the year. Now, the MEDIGAP insurance plans can be changed year-round. Those don't fall under these rules. Any month of the year, I can find someone a lower priced or a better coverage plan. Some new elements that have been added in recently for Medicare, it's really come into handy, are telehealth services and also some features under the coronavirus. There's a lot of plans, almost every single plan offers telehealth services to allow you to speak to a doctor or a counselor for free, virtually, either by phone or by teleconference. You should also pay no fees for coronavirus testing, including the new antibody testing that is coming soon. I think we have 3 or 4 that are now FDA approved, and your doctor should be getting those in shortly. You also should pay no fees for drugs to be delivered to your home. And you can get early refills on drugs from your pharmacy. These are important. Unfortunately, some drugs don't fall under that, such as opioids. And also, as a convenience, a couple of things that have happened. One is to free up hospital space, they have removed the 3-day hospital rule. So if you do go to the hospital and you need skilled nursing rehabilitation, they can move you over to that other facility quickly and not have to keep you in the hospital for a standard 3-day stay. Now, there's a lot of other things that you can take advantage of. If you're on a Medicare HMO or PPO, you want to take advantage of your over-the-counter benefits, such as free medical items that they'll deliver to your home for free, or the home fitness programs that you can just look at online and keep fit. So are all Medicare agents the same? Unfortunately not. Most Medicare agents fall under a category that we call set it and forget it. And they're salespeople, and they will sell you something and you'll never find them again. Only a small percentage of Medicare professionals provide annual management and year-round service and advice. Only a few have a staff behind them. So sometimes somebody has a Medicare agent and that Medicare agent is gone, there's no staff to help out. Only use also a Medicare agent that will show you all of the options in your area. Some agents say that they represent multiple options, but there might be 40 options in your county. And if they only represent 2 or 3, that's not going to cover the county properly. And also, only use a Medicare agent that provides all of their services to you at no charge. Thank you so much for joining today. We offer our free Medicare planning services. You can call us at 770-945-5261, or you can email Raquel@amsplans.com for a copy of this presentation. Bridget, I'll turn it over to you.
Thank you, Keith, for providing such valuable information. And that you do all of this at no charge is such an amazing blessing for seniors and their families. You can see this presentation on Keith's YouTube channel, or we can send it to you or send the slides to you by emailing keith@amsplans.com. Again, that's keith@amsplans.com. Also, Keith has a library of educational materials for free. Download on his website at amsplans.com. In our next segment, we will be educated by Cherish De La Cruz of De La Cruz Law, highlighting the practical tips for organizing your estate plan. You don't want to miss her excellent information. Thanks for viewing today.